Vaccinated. After the pair is vaccinated, the first female and male officers will also receive their jabs. Now, President Cyril Ramaphosa and the Acting Minister of Health, Mmaloko, Kubayi-Ngubane, are expected to attend. The SAPS has 107 registered vaccination sites across the country where all will receive their first jab of the Pfizer vaccine. But for more, let's now bring in our reporter, Khehla. Well, we'll be chatting to Khehla in just a moment. But for now, let's listen in to Police Minister Bheki Cele.
It has been really a long walk to be here, especially from the family of the South African Police. As you know, that we are always there. Well, there is this argument of our definition, whether we are frontline or we are essential, whatever it is, but we are always there. The sad part of it is that we reached this point when we have lost about 672 of our members. We wish that could have been earlier so that we don't lose those members. And those 32,000 of them, 500, who have been infected, thanks God that 30,000 out of them have really recovered. So you see the members that are here. Today will be injected 900 of us, starting with me and the Commissioner, and we believe that that will help this family of SAPS to be able to work and be protected so that can be able to protect other people. I don't want to talk too much. It's really a good morning. We love to be here, and we thank all the stakeholders, GEM, Polmed, and the members that have made this day to happen, and everybody else, including the media, that have been worked with us on this one. There's been this question when police are getting their jabs. We are here, and the program will roll out. We've got about 180,000 plus members around the country, and we hope it won't take too long. Everybody to get his job in different provinces. As we start here, it will be rolled out. The proper day of rollout will be the 8th of the South African Police. We're not too many. We hope in a very shortest possible time will be finalized, and we believe will be much safer after that. But I do want to make the point that everybody makes, that the jabs that we are getting today, we still have to work on other things that we have been doing all the time. Social distancing, that unfortunately is not very prevalent today here among ourselves. We think that we need to do the mask, washing of hands, sanitizers, keeping a little bit of it in your hand. Those things, even after we have taken our jabs, we'll have to really look at that. So I don't want to talk too much. I want to see things happening, and I want to tell you, it's not every day I'm happy. Especially to be happy on Monday. It's a very scarce commodity to be happy on the Monday. It's a beautiful Monday. Thank you very much, Minister. Thank you, National Commissioner. Thank everybody. Thanks, Dr. Changu. Thanks, everybody that were here. I want to repeat, we are happy on behalf of the family of SAPS. Thanks.
Thank you, Minister. We will please allow the Acting Health Minister to also have a stab at today's function. Over to you, Minister.
Thank you very much. Let me appreciate this moment. It's a milestone in our vaccine program. As Department of Health, you note that we have announced previously that our rollout goes in first with the citizens. We've moved from 60 plus, and now we are at 50 plus, and we'll be cascading down. And then we said the other multiple approach that we are taking is sectoral vaccination program. Today, as we take this milestone of launching the police vaccination program, we do note that those who have not been finalized in terms of we are working on their dates will take this as a milestone. On Wednesday, as we do the Police as well, full rollout. We're rolling out for even military, full rollout. We're also looking at concluding all the frontline, what we call the security cluster area. In terms of this, we note that correctional services, metropolitan officers are saying they want to know their date. We will be announcing those very shortly in terms of our vaccine rollout. This is a milestone that we are looking for as we look forward to herd immunity in the country. Quite a lot of progress around vaccine program, as you have seen SAPRA last week announcing the approval of Sinovac as well, which becomes one of the things that boost our morale and boost positively towards our vaccine program, because it means that we now have multiple vaccines that are available for us as we continue the work with the scientists to analyze whether we can go back and utilize what we call AstraZeneca. Though currently we are still cautioned around AstraZeneca, though we are seeing Delta variant dominating or growing, but we still have the presence of Beta variant, which makes it difficult for us to move completely to say we will utilize AstraZeneca. So currently the process that we are doing, we are rolling out with the police, with the J&J vaccine, which will be happening here. And that's what we're trying to make sure that each and every sector that we have committed to say that we will roll out will continue. The productive sector in terms of our economy as well, we have started the rollout. The mining sector, we are seeing increasing of that. So this part of the vaccine rollout, as we are doing with the police, is very critical. Why it's important for us, we've always said SAPS is a partner in assisting us to manage the pandemic. As we do from health, doing our best in terms of hospitalization, in terms of recommending restrictions and all that, it leaves law enforcement agencies in the forefront of ensuring that what has been pronounced as NCCC and the president gets implemented, and that's why it's critical for them to be able to receive this vaccination. So we're really excited. We thank Minister Cele. We thank NESHCOM together with the entire SAPS team. We thank Parliament, because without this partnership, we would not be able to reach here. So it's a lot of work that happened behind the scenes between the Department of Health and the South African Police Service that helped us to be able to reach this milestone. So I really appreciate each and everyone who made it possible. We're not re-registering in terms of the sectors. What we do, we simply migrate data from one area to the other. That's why it makes it easier. So there's a lot of team that goes behind the scenes to make sure that there's cleaning of data, making sure that they've got everybody, so that by the time they come, we're able to roll out. So the competition and the task for Minister Cele is to surpass what the teachers have done in terms of the numbers. So daily stats, as we report for the teachers, from Wednesday we'll be reporting for the police, and I hope police do not disappoint. They go out in numbers and get their jobs. Thank you very much.
Thank you very much, Minister. Before we allow for question and answer, I would like to give an opportunity for the first uniformed member of the South African Police Service who's going to be taking the jab. Of course, it is the National Commissioner. Please can you join us, General? General, just maybe take us through the message that you have for the 180,000 police officers that are going to be expected to take this vaccination. What's the message you have for them?
Yeah, thank you very much. Yeah, firstly, I just want to indicate that this is not happening by accident, and it's not incidental. It's by way of the turnaround vision of the South African Police Service. The first deliverable being that of building a healthy organization. We know that we cannot fight crime with an unhealthy workforce. And today, the taking of the vaccination is a demonstration of this deliverable for us to show to members of the South African Police Service that we invest in their health. And we want to make sure that as they go out there, they are safe. And in addition to the turnaround vision, this is part and parcel of the police safety strategy. The police safety strategy was also designed to make sure that our members are safe. And as you see them here in large numbers, they are the ones who are put in the front when things happen. and they've also been deployed to support the Department of Health in their endeavor, firstly to make sure that we control the virus, but secondly to also further make sure that we secure the vaccine. There's various attempts and new modus operandi that has already been introduced with regard to the vaccine. We have done takedowns where vaccine has been tried to be brought into the country in other ways, and further attempts to try and disrupt the vaccine program that is introduced by the Department of Health, and the police are there in the front. My message to the South African Police Service members, I think, is that as the South African Police Service, down there in the turnaround vision, there's our patriotic slogan of rendering a selfless and patriotic service. Let us continue to do that. Government today, through the Commander-in-Chief, through the ministers, as you've seen them demonstrating their support to us, I think they've shown that they care, and they've supported the caring nature of the South African Police Service. Today, let us all take the vaccine, but I'm making a call to all of you, all the police stations, all the 9 provinces. Let us all come out and take the vaccine and make sure that we are healthy, and we go out there and support the program of getting the whole nation vaccinated, and further making sure that the whole nation sticks and comply with the COVID-19 protocols. Thank you.
Thank you very much, General. We are going to allow for the police unions to also have a word that they could add to this conversation. I'm going to allow for Pub Crew to start. Just take our media colleagues through your feelings for today, and just a short message from the union.
Okay, thank you very much, members of the media. As workers within the South African Police Service, today is a day that we have been waiting for, after we have lost so many members in the line of duty, and we saying, let everybody stand up and hit the call. This is quite a clarion call, and we're happy. I think the Minister of Health have also expand on this program, that correctional service is also coming, and all the departments are coming. But members of the police, we are very happy, and we will do our job free, in as much as we still have to comply with the rules of the pandemic. But we're very happy, and let all of us line for a jab so that we could do our job very freely. Thank you very much.
All right. We'll also just allow for the President of SAPU, Mmaloko, to also just give us a word or two.
Thank you very much, Minister of Police and your Deputy, Acting Minister of Health, the National Commissioner and the entourage, DNCs, good morning. Look, as a South African Policing Union, we really appreciate this initiative, and we welcome it with both hands. However, it has been a long-awaited moment whereby we wanted our members to be vaccinated in order for them to be able to do their work without fear of this pandemic. Supporting this initiative, we will then request all our SAPS members and all the employees employed by the department to go and vaccinate when the time comes. In each and every province, as we know that Gauteng is an epicenter, we don't want to see a situation whereby we hear that members did not come to vaccinate, and we have a lot of death numbers. So we appreciate this minister, and we support it as the South African Policing Union. Thank you.
Thank you very much, Vaccination Cele. Last but not least, let's hear from Paul Med for making all of this possible. Ma'am Khawula, can you please just join us here? A short word from Paul Med around today's function.
Thank you. Paul Med, protecting the protectors. We have always tried to make sure that our members are protected. We did not just only provide for today. We have started a long time ago. We have already given our members vitamins to last them for 5 months. So most of our members have already received their vitamins as we speak. So for the jab, it's just for us to make sure that the immune system that we've already built for our own members, that it will continue. We also encourage our members' dependents that they must also find a suitable spot to get their jab. Specifically now that we are vaccinating from the DOH over 50, please, dependents of Polmed members, we are vaccinating the main members today, or the principal members, or the active members. Please make sure that you are also protected, because they'll come home having received the vaccine. So we encourage you as well with your dependents. Once it hits your age, please go and vaccinate. We are thankful for those over 60 members who've already vaccinated. We have about 4,000 of our dependents that have already vaccinated that are over 60. We now encourage those that are over 50 to please go and vaccinate, because that window period has been open. For the active members, if you work for SAPS, it doesn't matter whether you're a Polmed member or you are a GEMS member, please hit those vaccination sites. We have 108 of them. From the 8th, is it Thursday? From the 8th, you can go to any vaccination site in the country to go and get your jab. No need to register. You are already registered. You just need to show up and get your jab. Thank you so much. For those who are here, congratulations for the bold step that you have taken. The vaccine will not mark you. The vaccine will not do all sorts of things that you were told it will do. It does have some side effects. They are mild. We've communicated those side effects to you already. We did indicate to you that your body will react once you receive the vaccine. It's nothing detrimental or lethal. It doesn't mean after you're vaccinating you won't be able to walk. You will be able to walk back home. And we encourage people to please do not listen to all the information that is not true that you are receiving from everyone else. People all of a sudden have become professors, and they'll tell you all sorts of things. The vaccine, like any other vaccine, will have its own side effects. Like any other medication that you take has side effects. So vaccines will have some minor side effects, which we've already communicated to you. Please just go and read what those minor side effects are, so that you don't get surprised when you do get those side effects. Do not think that when you get those side effects, the jab is actually not working or is lethal. So thank you so much for all the members that are here at Polmed. We encourage you to please continue protecting yourself. You are protecting others. We love you at Polmed. Polmed protects the protectors. Thank you.
Thank you very much. Thank you very much. Now we are getting to the Q&A part of this very short, as I mentioned, briefing. I'll take 5 questions, but I'll obviously take it in rows, just by a show of hands. And you know the process, ladies and gentlemen. Identify yourself so that the principals know who they are speaking with. I'll start with you, Malungelo, and I will also go with you. I'll just answer your face because you're wearing a mask. Go ahead, Malungelo.
Hi. Yeah, can you guys, yeah, so that you can speak on the podium.
That's fine.
Hi.
A little bit more closer, please.
Hi, wena.
Okay, colleague.
Too much.
Okay, go ahead, Malungelo.
My name is Malungelo Boy from News from Africa. Minister, I want to get a sense, how are you going to deal with vaccine hesitancy amongst your members? But also I want to take you to the weekend. Are you satisfied about how police dealt with the issue of in Nkandla over the weekend, where people were violating lockdown regulations? The other question that I have, Minister, former President Jacob Zuma has made that application of stay of arrest at the High Court in Pietermaritzburg. Does that mean he can't be picked up by the police, or are the police waiting for the outcome of that application before or they can act? Just clarify that for us, because there's so much that has been said regarding this particular
Okay,
issue.
let's take that question. Minister?
Firstly, I thank Dr. Mahlangu, who has made the call, the National Commissioner, the acting minister, to make the call to the members of the South African Police to say that we don't have any other scientifically proven way of preventing this disease at the present moment except taking the jab. Members of the South African Police Service are quite enthusiastic of taking the jab. We'll keep that way. We haven't received any negativity towards the jab, so we'll encourage that happens. Secondly, the police were given the timeline of Wednesday, 12 midnight. So actually our 3 days started 12 midnight. We out of 72 days, we still have got a lot of hours. In between, there will be a court tomorrow. That will be day after our day, and will be a day after. It's before and after. So we don't have crisis of time. But also, we hope that we will be getting the clarification, because when we were giving the instruction, there were no other legal activities taking place. As the South African Police, the ministry, as we instructed with the Commissioner, we have sought the better clarification. Are we waiting for the new activities that are happening in court, or we continue as the present instruction? So we have time on that one. I don't think we need to rush. Going to Nkandla yesterday, there's been this thing that police have not been there. We have been always there. I think the Provincial Commissioner worked very well to say that you don't see us on TV, it doesn't mean we're not there. We have really prepared. National Commissioner and myself, we took a good time in preparation of Nkandla. Personally, I was there, I think, as from Friday, in preparation of the weekend. By then, we didn't know that there'll be these other court appearances. So we're preparing for our day starting from today. Those preparations were well and very much in place. The question that you are asking is about the response of the police at the activities of Nkandla. I want to take that. I want to congratulate the police, the way they behaved at Nkandla. The problem is that the information people that don't have, we will have. There were about, that is proven, Malungelo, there were more than 100 people there that were armed and were mingling within the people that you saw at Nkandla. There were more than 100 coming from some hostels and coming from some areas in KZN, armed. Now, police knew that. Police had that information. To show that, they even tried to provoke the police by having those firearms used there, shooting in the air and all that. There were many women, there were many children. And the police had to take a step back. At least we had to take and absorb the insults and those complaints as we are, rather than jumping on the blood that would have been there, and we're talking about that blood. But South African police, we all learn. We have learned through Marikana. And there were things after Marikana, there were Falam and all that. Even some suggestions that come from Falam were utilized there. We had 20 cameras of the South African police. So that data is with us. We have, as you have seen on different channels of TVs, that data is with us. We are working on that. We prefer to go there, go after those people, as we have sent Commissioner has sent an extra detectives in KZN to work with the police there to work on that matter. We will be dealing with that matter, but we are glad and happy that we're dealing with that matter when there is no blood, where there is no woman and child dead, which easily could have happened if police recklessly acted. So that's why I'm saying that we are very glad that we absorb whatever criticism, rather than we'll be talking about blood today that would have really spilled in that area.
Thank you, Minister. That's quite clear. We do have to cut this a bit shorter because of the function of the day. So I'll take 2 last questions. Okay, I see you, brother. There's one over here, and there's okay. The last 3 questions, colleagues. Do you agree? Go ahead, ma'am.
Thank you so much, myself for my SABC. Minister, we do hear that you're quite satisfied that there was no bloodshed in Nkandla. Well done, congratulations. But can you please tell us, for the ordinary South African that is sitting at home and was watching those events, people were clearly breaking lockdown regulations, that the police have a responsibility to enforce outside of the politics of arresting the former President Jacob Zuma. As a South African, am I allowed to walk around without my mask? Am I allowed to be part of a gathering that's more than 50, that's not a funeral? Can you please clarify what is the function of the police when it comes to issues like that? And have you arrested anyone from Nkandla? Thank you, Mr.
Well, I think I've explained that. The police have responsibility. The police responsibility is defined in many laws, but the main law here is your constitution. That constitution 205 sub 3 said the job of the police is to enforce the law. But in the same sentence is that is to protect the inhabitants of the country. So it wouldn't have proper, and it would be reckless. As I'm saying, you didn't have information that there were 100 people that had guns there who wanted to shoot at the police. And once the police is shot at, they must reply. And bullets have no eyes to say this is a child, this is a woman, and all that. To say that police having done anything, I've given here the information that we're 20 cameras there. That information is there, that data is there. Besides, we're working with the channels to have the data there. We've sent extra detectives to work on those things. We will be picking our people. That we did not pick them on that particular day, it doesn't mean we're not going to. So the South Africans must they must continue to obey the law. The crux of the matter is that if you break the law, you will be arrested, either exactly at the spot where you break the law or at the later stage, but you will be arrested. So we are not encouraging, and we don't want to encourage South Africans to break the law, because there will be consequence. It might be late, it might be immediate, but it will happen. Police there did not retreat because they were scared. We had a big contingent of police. Around there were about 200 police, and even including the special forces and all that. So special forces, when they get in there, and somebody who's reckless, who has no responsibility whatsoever, who wants to cause chaos, we are not going to be sucked in the chaos of the people that, when the life lost, they have no responsibility to explain. So we had to really take our lessons. We have a referral point in South Africa. We have Marikana, and we don't want to go back there.
Thank you, Minister. We'll take the last 2 questions, and very quick ones, colleagues. We have to really cut this short. Go ahead.
I've been answered on the other ones.
Okay, wonderful.
So I'm Deputy Minister.
Okay, go ahead.
I'm an acting minister.
It's Mmaloko from the Soweto newspaper. Minister, what is your target date to end the vaccination of police officers? And finally, when you look at the vaccination rate of essential workers like teachers, it's going at a very slow rate. So what guarantees do you want to give that police officers' vaccination rate will be done quick?
Well, I think Dr. Mahlangu can help us on that to give us the timelines, or General Vuma. For me, if you were asking my wish, it would be today, that everybody get vaccinated. We're not too many, we're 180,000, and we have several stations, more than 100 stations. I think the 108 themselves, the station around the country. And once it begins to roll out on the 8th, we don't expect many days to finish. And I can assure you, police are quite enthusiastic about it. I don't think there'll be resistance. When it comes to teachers, it's a clarion call we'll make that it's good for all of us as South Africans to do it, especially those that are essential and on the front line. But for now, the clarion call goes to the members of the South African Police Service to say this is the best way for now, including the non-pharmaceutical ways. Let's keep on that.
Fantastic. Thank you so much, Minister. Colleagues, I'll allow General Peters just to explain who and when can join the Minister as they go through the process of vaccination.
Thank you, Lirandu. Thank you, Minister. Thank you, National Commissioner. Good morning, colleagues from the media. I'm sure I do not have to explain the dynamics that we're dealing with and the reasons why we need to take some of the decisions that we are taking. But we have a live streaming link which we advise and encourage most of the media to take, especially your radios, your print, that if you are going to need footage, please use our link. So we are going to propose that we have Newsroom Africa, SABC and ENCA, those are the broadcasters, and Soweto TV to accompany us. It'll just be in front here for your convenience, where the Minister, the National Commissioner, the Deputy Minister, as well as 2 police officers who will be the first operational members to receive the jab. So if you could allow these 4 broadcasters that I've mentioned, and then the others can just maybe hang around in the background for them to come through and cover the actual vaccinating of the Minister and the other principals that I've mentioned. I hope it's not going to be a problem. We all understand why. So if we could please allow us space so that we can move through for the vaccination to take effect. Thank you, colleagues.
The launch of the vaccination drive of police officers in the country in progress, with Police Minister Bheki Cele leading the proceedings there. And we've heard him say that more than 670 officers have already succumbed to coronavirus, and about 30,000 of them being infected across the country. And he'll be the first to receive the jab, followed by Police Commissioner General Khehla Sitole. Khehla Sitole, beg your pardon. And what's more important that Bheki Cele has mentioned on the issue of people, hundreds of people and possibly thousands of people flouting lockdown level 4 regulations in Nkandla yesterday. He said that, well, he was quite vague in terms of why the police oversaw that, why the police oversaw people, flouting regulations. And safe to say, he only said that, they have to tread very carefully. They need to investigate the matter further to avoid another Marikana massacre. And he was also joined by Mmaloko Kubayi, the acting health minister, who said that it's very critical for the police to get the vaccination, as they are the frontline workers. We also heard Khehla Sitole, the police commissioner, saying that this is not accidental or incidental. It's seen as an extension of the vision of the South African Police Service, and they cannot fight crime with an unhealthy workforce. So, well, that sums up the launch of the vaccination drive of about 180,000 police officers in the country under the SAPS. All right, on to other news now.